The Hedera helix extract, Prospan, consists of three components: flavonoids, caffeic acid derivatives, and saponin 3-terpenes. Prospan's most significant saponins are C-heteracoside and alpha-hederine. The latter is the primary element accounting for Prospan's therapeutic effect. Prospan extract is used as an expectorant. The effect sought is to promote the secretion of bronchial fluid, to reduce mucus viscosity, and to promote bronchial relaxation, resulting in a reduction of cough. After Prospan is swallowed, alpha-hederine is absorbed by the enterocytes in the small bowel. It enters the bloodstream and is carried to the lungs bound to the membrane of the red blood cells, presumably bound to the membrane cholesterol. When it reaches the lungs, alpha-hederine inhibits the internalization of the beta-2 adrenergic receptors, both in the type 2 alveolar cells and in the bronchial smooth muscle cells. Consequently, the tissue will remain sensitive to adrenaline. At the level of type 2 alveolar cells, the inhibition of the internalization and activation of the beta-2 receptor by adrenaline leads to the activation of the enzyme adenyl cyclase, which induces an increase of cyclic AMP concentrations, which in turn results in a greater production and secretion of surfactant. The surfactant's increased exocytosis results in a decrease of mucus viscosity and a reduction of cough intensity. As observed in the alveolar cells, the stimulation of the beta-2 adrenergic receptors, also present in the bronchial smooth muscle cells, increases cyclic AMP concentrations. The increase of cyclic AMP concentrations, in turn, leads to a reduction of intracellular calcium concentrations due to the latter accumulation in the endoplasmic reticulum and to its exit from the cell membrane through ion channels as a result of the reduced production of active myosin kinase. This causes the relaxation of the bronchial muscles. As a conclusion, the inhibition of the internalization of the beta-2 receptors in the type 2 alveolar cells by alpha-hederine increases the cell's beta-2 adrenergic reactivity. The stimulation of the beta-2 receptors of the type 2 alveolar cells leads to a greater production of surfactant, which favors the fluidification of viscous mucus. This cyclolytic effect is involved in the relief of cough. The beta-2 adrenergic stimulation is followed by a reduction of the intracellular calcium levels in the bronchial muscle cells. In the case of bronchitis, it causes the contracted bronchial muscles to relax, thus accounting for Prospan's bronchodilating effect. Only alpha-hederine inhibits the internalization of the beta-2 adrenergic receptors. However, C-heteracoside can be considered a prodrug, since it turns into alpha-hederine in vivo as a result of the action of esterases.